In Gauteng, the Premier, David Makhura, says the Wits Reproductive Health Institute is important in the fight against COVID-19. Makhura has been assessing readiness ahead of the phase 2 vaccine rollout, and he was up and about earlier today. He was joined by the Health MEC, Dr. Nomathemba Mokgethi. The second phase of inoculation is expected to begin next month. That's in May. My colleague, that's ENC reporter Govan Whittles, has been tracking that story for us, and he's joining us now here on the Midday View at this hour from our newsroom. Govan, good afternoon, and thank you very much for being with us. Tell us what has been said about the significance of this institute amid this pandemic.
Yeah, so the Wits Reproductive Health Institute is turning 27 years old this year, and it's important because the Premier believes that some of the research that's been done at the Institute is valuable in assessing what to do about the coronavirus in the province and to also alter the government's response to it, depending on what the research finds. And the Institute, the RHI, has been fundamentally researching the effect of COVID-19 on people living with HIV, whether they're more susceptible to it, and whether to contracting it, and whether they're more susceptible to landing in hospital or even dying because of COVID. And they've had some interesting results with the research, but they've also been looking at how COVID-19 affects people who are currently on a regimen of treatment for tuberculosis or have been diagnosed with tuberculosis at the same time as being diagnosed with COVID. And this is all in an attempt to tailor the Gauteng government's response to those populations. And the Institute is also very valuable because its research also looks at how mothers who've received vaccines and babies have responded to them, at least within the first couple of months. And it's within this context that the Premier went to go visit the Institute today, and saying that based on what they found there, they might tailor how they roll out phase 2 of the vaccine, particularly the lessons that are to be learned from how the Institute has been tracking people who require a TB medication or HIV medication. The Premier also, interestingly, noting that during the lockdown, they lost track of more than 200,000 HIV people, positive people who were on antiretroviral treatment, and saying that their efforts to relocate these people who they've lost track of will also be useful in trying to find people for the second dose of the vaccine.
Yeah, it's a busy day regarding that phase 2 of the rollout, and we've seen how important planning and preparation is. I know David Makhura should be joining the Minister of Health this afternoon after 2 o'clock, in fact, at the Charlotte Maxeke Hospital, which was affected by a fire earlier. But that facility for the rollout of the COVID-19 jab is still there, standing. So what did the Premier, when you spoke to him earlier today, say about the rollout of the second phase?
Yeah, the fact that the centre where the people will be getting vaccinated at the Charlotte Maxeke Hospital is still standing means that the community and the residents of Hillbrow, where the Wits RHI is, will most likely be making use of that facility to get their vaccinations. And the Premier today weighing in on the question of undocumented migrants and foreign nationals in South Africa and whether or not they'll be eligible for registration for phase 2 of the vaccine rollout for people over 60 and those who have comorbidities. And at this point, the Premier is saying that the vaccine won't be reserved for South Africans only, and it's the duty of these medical practitioners to give it to people who require it as soon as possible. But saying that they'll be guided by the National Coronavirus Command Council as well as the national government on what to do with regards to foreign nationals or undocumented migrants seeking the vaccine in this country. This, of course, he says, needs to be viewed within the context of the COVAX facility, which is providing X amount of vaccines to countries on the African continent, as well as the dispatching of those AstraZeneca vaccines to the continent and the extra J&J vaccines that will be coming from Aspen. Let's have a look now at what the Premier had to say about migrants and vaccines in South Africa.
I am currently focusing on 1.3 million people who are 60 years and above in Gauteng province. We will be guided by national government and the African COVID response on how we deal with migrants who are in our country who may not have the necessary documentation. But my priority now is to go to the townships and ensure that the townships and suburbs in Gauteng and ensure that we find these 1.3 million people, only 115,000 of them have registered so far. We want to register them. When the COVID vaccines arrive in May, we want to make sure that we have done all of them possibly by the end of June. That's going to be my principal focus. I know the health services in the province, their priority is to stabilize a patient who arrives there, and then they will sort out all other things later. That should be the more humanistic approach. You can't turn someone away because they don't. It does not work like that. They don't have an ID. They are dying in a facility, or they want to give birth there, and you turn them away for those kind of things. That's an inhumane way of dealing with issues.